Secretary for the Honorable Rod Phillips will moderate the Q&A session. If you're a member of the media and would like to ask a question at that time, please use the raised hand icon that's at the bottom of your screen, and you'll be placed in the queue. When your name is called upon to ask your question, you'll receive a prompt to unmute yourself. Please accept the prompt and ask your question in the format of one question and one follow-up. Now, at this time, I'd like to introduce the Honorable Rod Phillips, Minister of Long-Term Care, and invite him to share details about today's announcement. Over to you, Minister.
Thank you, Peter, and good afternoon, everyone. And I wish, of course, the best to all of you in this holiday season. I hope that you are having an opportunity to spend time with family and friends. Nothing's more important than the health and safety of the residents and staff and visitors who attend at our long-term care homes. We know that the Omicron variant is more transmissible than previous variants, and we also know that it is prevalent in communities across Ontario. Today, there are 41 long-term care homes in outbreak, up from 37 yesterday. 93 residents and 161 staff have tested positive for COVID-19. And as of today, there are no long-term care residents in hospital as a result of COVID-19. For this reason, and because of the Omicron variant, we must remain vigilant. That's why, in consultation with Dr. Kiernan Moore, the Chief Medical Officer of Health for Ontario, our government is putting in place additional measures to protect residents and staff in Ontario's long-term care homes. These measures build on an important series of actions that we have already taken. We required all long-term care staff to be fully vaccinated by December 13th, and earlier this month required everyone who is visiting a long-term care home to be fully vaccinated. As of December 17th, everyone who is entering a long-term care home required a negative test, regardless of their vaccination status. We are providing residents and those working in the homes with third doses. As of December 22nd, 84% of eligible residents and 43% of staff have received their boosters. These numbers are the highest in the country, but we continue to work hard to increase the numbers, and we're working with labor partners, operators, and others, including public health units, to make sure that we raise the number of third doses among staff and among residents. Designated caregivers are required to be fully vaccinated, with the exception of those with a valid medical exemption or those who are attending to a resident in a palliative situation. In addition, long-term care staff providing direct care or interacting with a resident with a suspected or confirmed case of COVID-19 are required to wear a fit-tested, seal-checked N95 respirator or the approved equivalent, along with eye protection, gowns, and gloves. Now, in consultation with the Chief Medical Officer of Health, and based on the latest scientific and medical advice, we're implementing new measures to protect our most vulnerable. These enhanced measures will help reduce the risk of transmission, particularly during the winter months. Effective December 30th, which is Thursday at 12:01 a.m., all general visits to long-term care homes will be paused, unless you're visiting a resident in a palliative situation. As well, social visits from homes will be paused. All residents, regardless of vaccination status, can continue to leave the home for essential reasons like medical appointments. Recognizing the critical role that designated caregivers play in the lives of residents, each resident will be continued to allow to designate 2 caregivers who may visit them. Now, I do understand that these measures will impact many families, but we must remain vigilant, particularly against the new Omicron variant. The COVID-19 vaccines remain the single best protection against the most serious outcomes when it comes to COVID-19. I would encourage anyone who has not gotten vaccinated yet to get their first dose. And if you are eligible for a third dose, please book that dose as soon as possible. I encourage you to make the choice to protect yourself, your family, and your friends. Thank you, and now I'd be happy to take your questions.
Okay, the first question, Minister, is from Holly McKenzie-Sutter. Holly, over to you.
Hi, Minister. I wanted to ask about the 41 outbreaks or homes that are in outbreak that you mentioned. Do you know how many of those would have been kind of either linked or traced to visits? Like, I'm just wondering kind of if there's evidence in the outbreaks that you're seeing that would, I guess, explain or justify kind of pausing the general visits.
The rationale, thanks for the question, Holly. The rationale behind pausing visits is just to reduce access from the community. As I've said consistently, the biggest single factor affecting the outbreaks of long-term care homes will be the prevalence of community spread. And as we are seeing every day, there is significant community spread, particularly with the Omicron variant. So the rationale behind the limitation on visits is that more people coming in from the community, when there's more COVID in the community, inevitably will lead to more spread in the community. So that's the rationale behind it.
Thanks. And I was wondering as well about if you've been having any issues with staff absenteeism or work shortages because of either people isolating or becoming infected with Omicron spreading so much in the community now.
Yeah, as you know, and thank you for that question. As you know, last week we made some changes along with other health area sector providers around some provisions to have staff be able to continue to work if necessary, as long as they're not COVID positive. But it is an area of concern. I think it's an area that's being addressed. We deal directly with those homes in terms of any feedback that they give us and make sure that support can be provided. But of course, like every other employer, those homes are finding that the prevalence of Omicron means that some staff are not available. So to date, all the homes have been able to cope, and we continue to work with them. And the ministry is in contact daily, as are public health units, with any that signal an issue for us.
The next question comes from Sean O'Shea from Global News.
I think you might be on mute, Sean. Sean, we can't hear you. It says you're muted at the bottom.
Sorry about that, Minister. Can you hear me now?
We can't hear you. Thanks.
My apologies. Thanks for taking my question. Just back to the previous question, though, what has changed that would put into place now this rule? I mean, you knew going into Christmas that there was going to be problems. Everybody else was being told to be very careful. I mean, really, what has changed in the last 4 or 5 days to necessitate this?
Well, we have the most recent information, including from the science table and others, that are indicating the prevalence even among vaccinated individuals from a transmission perspective. That's new information. And of course, we put in place the requirements around vaccination for all staff back previous to Christmas. In addition, going back even to early October, requiring full vaccination for staff. So along the way, we've been taking the steps that are necessary. But what I do is consult, and I spoke today, as I often do, with Dr. Moore. These are the steps that he believes are commensurate with the risk in the community. And as I've said before, and I've said frequently since June, the significant community spread is going to be the biggest factor that affects long-term care homes, because there's long-term care homes are inside a community. And so as we see the spread of the Omicron variant, we're going to continue to take steps, particularly to reduce transmission from the community. And obviously visitors coming in from the community is one of those areas. So that's why today's announcement makes sense.
And then just to follow up, there are many advocates who say that you're doing what will ultimately harm people in those facilities, the isolation aspect. This is, 2.0 on that. What do you say to people who look at their loved ones who are in those long-term care facilities and go, this is their only outlet. It's been a tough 21 months, 22 months, and now you're cutting them off yet again.
Yeah, Sean, and I appreciate the question. We are fundamentally taking a different approach that was taken in the past. And I think there was a lot of good advice from medical professionals, but more importantly from families. So there are 45,000 caregivers across the province. Those are the people who are day-to-day most frequently into homes. They are the ones who are designated by the resident to provide support. So we are ensuring that those 45,000 caregivers can still have access. Now, I did require as of last week that they be vaccinated to get access. But that's fundamentally a different approach to make sure that those vital connections to family and friends are still available. And we're going to do our very best to make sure we can ensure that.
We have one more question from Holly Mackenzie Suter.
Hi, thanks for doing another question. I was wondering as well about, the outbreaks seem to be, the numbers are going up pretty fast. I mean, officially on the website from like last week, it was 26, I think. And I'm just wondering if you could talk a little more about breakthrough infections, like any more characteristics about whether it's unvaccinated or partially vaccinated, and like what's happening there in terms of the trends you're seeing.
Yeah, thanks for that question. We're doing that work with specific public health units who are on the lead in terms of contact tracing. But we are certainly seeing a range of sources, not just one particular source, in terms of where we're seeing outbreaks come from. Clearly, what they do over the common characteristic is they're coming from the community outside. As I said before, the prevalence of community spread is going to be a factor affecting long-term care homes. So there are a range of the typical sources, but the community is finally the source of that. And to the extent that communities have more spread, particularly of the very transmissible Omicron variant, then we're going to have to keep prepared and keep taking the right kind of measures to protect long-term care home residents and to protect the staff.
Thanks. And I was wondering as well, because we know Dr. Moore was supposed to have a news conference today and it was canceled, but ministry has told us they're thinking about changing guidance around isolation, similar to what the CDC just updated their guidance in the US about 5 days isolation rather than 10. And I'm just wondering your position on that and how it would apply to the long-term care sector, given how vulnerable the residents are to have someone who has tested positive working so recently after a confirmed infection.
Yeah, so I do understand, and as I said, I spoke to Dr. Moore earlier today. I do understand he's reviewing not just the CDC guidance, but all the most recent science and information, and that he'll have something to say about that later in the week. We'll obviously look specifically at how that applies around long-term care. We're talking about a very, very vulnerable group of individuals, but Dr. Moore and his team have been very, sensitive to that and supportive of that. These recommendations today, again, developed specifically with their guidance in mind. So we'll look to have that conversation once they've reviewed the guidance, and we won't hesitate to do what's required in terms of putting in place the protections that protect residents.
There being no further questions, this concludes the question and answer portion of this event.
Thank you, everybody.